Oh, it's nice to see you. We've never
Is
met
it?
before, but it was just by accident I actually came across you because I've been interested in ultrasound in my aesthetics work for probably the last year or so, and it's the training in particular that I was most interested in to find out what would be involved. And your stories popped up via it was probably Leonie Schelke,
Mm.
Dr. Leonie Schelke, who's based in Amsterdam. And I think she works for her own group of a group of doctors called Cutaneous in
Hmm.
Amsterdam. And I think you were very lucky to be able to carry out training recently with Cutaneous, I think. And it was based, was it in London, down south a
Yes.
few months back?
Yeah. So basically, it was at the BMA house,
Yeah,
and I don't. It kind of all fell into place, really. I think when I found out about the course, it was because I was actually looking to purchase the Clarius
yeah,
ultrasound machine, and then yeah, and then I just come across the course. And to be fair, it's not when you buy the machine, you kind of think just, oh, it'll be all right. I'll be okay. And then you
yeah,
realize that, well, what's one of the comments of the course is it's 50 shades of grey,
yeah,
because it literally is. And it is quite hard skill to master. So
yeah,
I would strongly suggest that you go on this course. And,
yeah,
it's a 2-day course. It can be quite, for some people, that might be too much for them, but
yeah,
you need to build on your skills, and you need to
yeah.
have them 2 days, definitely.
No problem. We'll talk more about the actual training and about the ultrasound use in a bit. But I've never met you, and if others watching haven't really heard of your background, we'll go through that first if that's all right. So I'm Viv. I work at Skinpharma, which is my clinic, and I'm based up in Stockton-on-Tees, up in the northeast of England. So Kara, you've got your own company called Dr Kara Aesthetics, is that right?
Yeah, so my clinic's actually called Dr Kara Cosmetic Clinic, a bit of a mouthful, um,
Yeah.
but but that's the clinic's name. It's based in Norwich, in the UK. There is only one clinic. We are in the middle of nowhere. You definitely want to be coming to Norwich, but I do love it. I've been living in Norwich now for how many years now? A good 11, 12 years. So I now
Right.
call it my home. I think they've adopted me. But yeah, I did all my post
I've only,
grad training. Sorry, what were you going to say?
No, no, I've only been to Norwich once on the Norfolk Broads, and it was a nice place to visit. It was probably about 10, 15 years back now, but nice part of the country anyway, I think. It's nice to visit areas like that. So you do the
Exactly.
aesthetics work, but you've got more than one job, haven't you? You do other work as well.
Yeah, so I like to keep myself busy, but no, look, I split my time between being a GP and running my aesthetic clinic. So I work 3 days a week as a GP. Love it to bits. I've been doing that now for just over 5 years now, as long
Yeah,
as I've been doing aesthetics. So
yeah,
and yeah, they're both my passions.
yeah.
But yeah, it's good
So,
fun.
so how did you start in aesthetics? You began working as a doctor, qualified as a GP. How did the work into aesthetics start off? How did that begin?
Again, I don't. I say I don't really know. Um, you know, I suppose when in my last year. So if I explain how I came across training in my last year, I was. I don't know. It was in my last year of GP job, and I decided that what I'd do was go on a Botox and fillers course, which was where most people start. Now, I'd always been quite interested in that type of practice, and I think my family background as well. My mum used to be a beautician, and my sister used to
Yeah,
be a hairdresser. So I've always kind of been quite conscious of that. And I was coming towards, the age when you start to notice aging. So I had a little bit of a invested interest into it. And yeah, and then that's when the passion really started,
yeah,
because it's got a great mix. You've got science behind it, and then you've got an artistic flair. And
yeah,
I've always been very artistic. but it just transferable skills. So it was
Yeah.
perfect. So yeah.
So you've been doing aesthetics for a few years now, have you, Cara, with your GP work as well? What would you say you enjoyed most about it, and what maybe are the things that aren't quite so good about doing the aesthetics work?
So I suppose the things that I enjoy the most about is one, again, like I said to you, and it's very, there is a science behind it, but there is also the artistic part of it. And do you know what's really nice, and the common themes that run between GP and aesthetics is the happy, smiley, confident faces. You know,
Yeah,
if you are helping someone, you know, it's a part of my doctor trait, my is just trying to, you know, help people. And I think that's the common misconstrued of what aesthetics is that a lot of people think it's just for vanity. And don't get me wrong, you know, a part of it is to look better, but it's also
yeah,
about your self-image and self-confidence. So I get a lot of fulfillment out of doing
yeah,
that. Now, I
yeah,
suppose you said you asked about, say, some of the downsides, did you say?
yeah, yeah,
You know, I'm going to say, I'm going to be very honest. You can get some, because you're working in it's private practice.
yeah,
And aesthetics can be, it's very subjective. And you get the very odd person that might not necessarily, they say, agree with you. So you're having to deal
yeah,
with a different side of things. But then that comes down to really your initial consultation. I don't treat anyone same day. I make everyone have initial consultation so we can get to know each other, so we can
yeah,
both be on the same or singing from the same hymn sheet. So I
yeah.
suppose that's the only thing.
Yeah, no, it's good. It's good that you're open about it. I suppose it's better when you're honest with people as well, people that you speak to, patients. In terms of your work, you'll have probably come across lots of different practitioners, probably more online than face to face. But how well do you get on with other practitioners? I can say for myself that we've gotten well, even though we've only known each other for a short time. So
Yeah.
I think people must enjoy being able to speak to you. And do you get on well with other practitioners?
Yeah, because do you know what? I've always thought this way, where it's very hard to put yourself out there. And I think it's also quite hard when you're starting your own business, especially in aesthetics. Aesthetics can be quite a lonely world
Yeah,
because most people start off being a single practitioner, like myself. And then you will learn quite quickly that you need to build a good support network to make sure that, you know, if anything, you just need that little bit of reassurance, or you just need a little bit of guidance to bounce things off. It's exactly what happens when I'm in my GP job. We often just nip in to just have a chat to each other, even if just because we just want to have a chat to each other and have a little
yeah,
giggle, and that's fine. But so I've really enjoyed building networks, especially on platforms like Instagram, anywhere really. But yeah,
yeah.
so it's been really good fun. Plus, I get to meet people like yourself, so it's nice.
Yeah, well, it's been nice to meet you. It was really, as I say, because of your ultrasound training. That's how I came across your account in the first place. There's probably other practitioners watching. There's members of the public watching this Instagram live. If there's doctors watching it, thinking about ultrasound, and perhaps not even realizing ultrasound can be used in facial aesthetic work, perhaps they're considering starting off in aesthetics themselves. Based on your own experience, what advice would you give any doctor considering the work in aesthetics?
Okay, so that's it's huge, that question. So,
Yeah, it
so
is.
okay, I think to break it down simply, you don't just go into, or you shouldn't just go into aesthetics thinking that it's going to be. I'm not saying it's going to be an easy job, but it is really tough. But more of that, your passion will carry you. And what I mean by tough is that, you know, like I keep saying, you know, aesthetics is both a science and art. You must make sure you have to understand it's a skill to perfect. You know, coming from when I first started over 5 years ago, come to now, of course, experience makes you a better practitioner. So you've
Yeah,
just got to keep going and going and going, but also being honest with your people that you're treating, to making sure that they know that maybe you are fully, you just fresh out of your course or whatever. But another thing to say as well, as it comes down to professional responsibility, a lot of my skills that I've done and honed from other aesthetic courses have already been taught to me when I was doing my medical training. I'm not saying that, of course, we weren't doing anything aesthetics when I was doing medicine, but a lot of transferable skills there. So I felt quite confident in doing some of the procedures. But don't get me wrong, I know you asked me some other questions, or show me some questions you were going to ask me about saying, you know, when you first start doing a course, if you just do a standalone course, so your foundation course, what I was taught, I think is a little bit like ignorance is bliss. Because when you start it, you're like, oh, everything's fine, and I'm sure this is how they've taught me, and you just kind of, not, in essence, it's a bit like paint by numbers, but there's so much more to it, and you get a bit of sensory overload, like, or information overload, because it's so much to take in. But I would strongly suggest to people just to say, look, if you go in these foundation courses, yes, trying to put into practice what you've learned, but realize that it's a foundation course, so you just have to keep going on, building on them skills, but going to, say, a reputable company, or there's loads out there to choose from, but it's definitely going to reputable courses.
I trained myself with Dermal Medical down in London with Zach Ali over a few years. I started around about 5 to 6 years back, so I've done quite a lot of work there. I've trained with Julie Horn over in Norway with lip treatments, so I've got a good range of training that I've gone through myself. Have you got any funny stories?
We're very similar.
Yes. You must have come across different funny areas of work that you've done, funny stories that you've come across. Is there any funny stories that you've got that you could tell?
Well, I've got to be careful. So some of them are probably a little bit more tongue-in-cheek. But I suppose the only thing, I suppose you can't say not really. Sounds really awful. But you get the odd person saying clinic where they say that they're absolutely fine, and then you'll be treating them, and all of a sudden you look at them and they're white as a ghost, and you just think, oh no, here we go. And obviously you have to stop, because obviously then it might be near faint. But I suppose the only other thing to say to you is that sometimes you're so busy in your clinic, and then you look down and you realise that you've been working with inside out trousers the whole day. No one's noticed. So probably the copious amounts of PPE that I've got on. But that was not my finest moment when I realised that, but no one cares. I still did my job.
I could tell you a few funny stories, but I'll avoid it on this occasion. I might go into it a different time, I think.
Exactly.
But in terms of the treatments that you carry out, you carry out a full range of facial aesthetic treatments. What sort of treatments do you actually do, Kara?
Oh, so I'll just quickly list them. So a lot of them are obviously dermal filler, obviously. And then things like skin boosters, the normal kind of injectable products, microneedling, chemical peels, obviously Botox, and skincare. So another thing that I actually was able to focus on more via the lockdown. The lockdown, in essence, look, it's been awful, but it helped me to slow down my pace of life and focus on my business, weirdly, and working from home, and then life being less sociable. But so skincare was integrated too. So it keeps me busy, and I realised you have to have more of a holistic approach to get that lovely, natural aesthetic outcome. So
in terms of doing these different treatments and being a GP as well, I suppose patient health and wellness fit in quite well with your aesthetics work. Do you manage to integrate that quite well in your regular day-to-day work?
Oh, yes. So, look, so only a couple of days ago, you get people that come to see you, and they'll want to come see you because they'll say, oh, you know what, like, I want to have help with me looking just, say, fresher and helping with aging. And then they'll slip into the conversation that they love the sun. And you're like, okay, it's a bit like swimming against the tide. Or they still smoke, or they heavily drink. And look, I'm not saying that I'm 100% perfect. Definitely don't smoke. But I would say to you that the sun is not your friend if you want to age well. And I'm never pushy. Like, I'm here to advise. But I suppose what I'd say is that people will end up doing what they want, in essence. But you're here to guide them. Equally, saying about health and well-being, I also think it's quite important to mention that you should be screening everyone. I'm not trying to tell you, I'm just saying that this is what I do. screening everyone for body dysmorphia. So that
Yeah.
is something that I've integrated with my initial assessment, the
Yeah.
medical forms, and we always go over, you know, whether there is any elements of that, and try to obviously help and direct them if I do feel that that might be the case. So, you
Yeah.
know, we have responsibility at the end of the day.
Yeah, yeah. You'll see a wide range of different types of patients all the time, I guess. Is there any particular treatments that you enjoy doing on maybe particular types of patients?
I suppose I'm not saying I'm saying I'm greedy with the face, but when I actually really like doing full face dermal filler treatments, and I suppose
Yeah,
it's because you get that instant you know, look and satisfaction from them looking, say, fresher, or getting that kind of anti-aging effect. It's just trying to convince people that maybe, you know, if they've just found you, say, probably from the internet, and they haven't found you from, say, referring from a friend, it's kind of convincing them that you're not going to give them that overfilled filler face, like, which literally someone said to me today, saying, well, maybe we should start small just in case, you know, I don't want to overfill my face. And I thought, I would never do this.
what do your patients think about you? Think about you and your work? Do they say anything to you during your normal day about what they feel about your work and what they think about you as a person?
Yeah, I've been often described as friendly, definitely still professional, but yeah, definitely friendly, approachable, caring. I am a little bit cheeky, but in a good way. But you know, and I'm always very open to us just having a chat. Like, I was doing someone's microneedling today, and we were talking about films that someone would watch recently. So, you know, we just always have a good old catch up and share funny stories. So yeah,
Yeah.
definitely put you at ease.
I keep forgetting I'm terrible at this. There's people sending messages at the bottom of the screen, and I always ignore them by accident.
Oh, good. I
But I'm
can't look
saying,
at them, otherwise I get distracted. So
yeah, exactly. I keep it on just so I can see. But I've got to say hello to MJ Smileworks, who you've trained with, I think, in London.
yes,
She
yes,
was really nice
lovely.
and put a few bits on a story earlier this afternoon. So just to say hi to her. And also Bell, who are the distributor for the Clarice equipment, they're on watching as well.
They are
So
indeed.
hopefully they'll enjoy listening to what we've got to say about the ultrasound. So in just one final question. What advice would you give to anyone who might be considering having treatment with you, Kara?
I suppose it would be, you know, I always tell people, I'm sure they've done their research when they've come to contact myself, okay? But uh, I always say to people, do your research, make sure that you like the practitioner's work, but also down to their professionalism. So make sure that they are hopefully regulated. So like with me, I chose Safe Face, but you know, you can also have CQC. The reason why I say this is that you then have a external regulated service to make sure your clinic is up to scratch and that you are safe.
Yeah,
But also their professional their qualifications, you know, be open and honest with
yeah,
people when they ask you. Look, I've been getting a lot of questions lately when people come to see me and they say, you know, what do you use, or what filler brands do you use? And you should be
yeah,
able to rattle them off and explain why,
yeah,
and answer every single question. So just be warned if you come to see me that I will be thorough, and I will make sure that I understand what your concerns are and talk to you at length about, you know, the benefits, but also the risks as well, so
yeah,
that we can basically make sure that that's the right decision for you.
yeah, yeah. You mentioned about fillers being probably one of your favourite treatments, doing full facial work using dermal fillers. So because of that, patient safety must be a big concern for you, and that really leads us on to what we're going to be talking about. How important for you is the patient's safety ultimately at the end of the day?
Well, I think being a doctor, you know, it's rammed home that we have to make sure that, you know, everything we do is to benefit, to cause no harm. And, you know, going into when I first started in aesthetics, we were blind in essence. We would say that this is the way that we would practice, which and what I mean by blind is, you know, we'd use a needle or we'd use a cannula, and talking about dermal filler, and that we'd hope from our knowledge of anatomy and hope that when we pull back that plunger, which is called aspiration, to think that, you know, that is safe and it's not in anything that we don't want it to be, like a blood vessel, that we're okay. And I just always used to feel apprehensive. That's the politest way to put it, is I used to feel apprehensive. And, you know, of course, I'm touch wood, it hasn't happened yet, causing a blood vessel blockage. But, you know, it could, and it will probably happen at some point. I'm not saying I am perfect at all, but I suppose that's the whole basis of when I found out that you could use ultrasound, I was like, well, that's our vision. We're no longer blind.
It's a good answer. As I say, safety is an important aspect of patient care for everyone who carries out aesthetic work. If you're a healthcare practitioner, we've got certain obligations as professionals to make sure we do no harm to our patients. So with patient safety being so important for you and for your patients, how did the whole idea of facial ultrasound come about for you, Kara?
So it's been a long time coming, really. I first found out about facial ultrasound probably about a year, maybe just over a year ago. And at the time, I was thinking to myself, oh, do I do it? I had a little bit of imposter syndrome. I was like, you know, what if it's like too hard a skill, or is it really needed? All these types of questions, because it was so new and there was so little about it. Of course, ultrasound's been around for yonks and years, but in facial aesthetics, it has not been, or not that I've been aware of. So I did a little bit more research, sat on it a little bit, and then I just thought, I just know I can be safer. And I know that I can prevent complications. I can treat complications more effectively. I can do treatments under ultrasound guidance. It just takes away the practitioner anxiety, but also minimizes complications. So really, it was a absolute no-brainer. And yes, it's, you know, it's an investment, and, you know, people will be wanting to choose maybe having a new treatment in their clinic. But actually, on the long and short of it, dermal filler is one of the most staples of most aesthetic clinics. So you need to make it as safe as possible.
Yeah. You mentioned anxiety and complications, anxiety. Do you think that's a problem when you first start working as a new practitioner?
Well, yes and no. I think that there's a lot of ignorance is bliss. So when you first start, I know that certainly from my first course that I did, you know, one of the most common things that gets taught to you is filling these lines here.
Yeah.
And they're really risky. And they're always taught with needle. And you shouldn't be taught with needle. It should really be done with cannula. But it's what's taught. And and it's scary. But what you don't know necessarily can't worry you. And I suppose what happened is later, when I was being more inquisitive, which I am, and I realised that there was complications happening, and why were those complications happening? And then that's when all of that kind of started to think to myself, actually, I've got to be definitely careful about this. And I've been, say, in essence, lucky that I haven't had anything like that.
I've found in my own work, I've been working for about 5 to 6 years full time doing aesthetics work. I found when I first started, I wasn't particularly fast, but I thought I would probably naturally get better and be quicker. But if anything, over the last 5 to 6 years, what I've found is because of going through more education, more training, you actually learn to actually be more and more careful as you get further in your progress with the work. You don't actually speed up, you actually slow down. Well, I do anyway. But I find it difficult because when you first train in aesthetics, you don't have the same knowledge that really you should have a few years later. And I think it's a difficult area for a new practitioner to consider, because safety is important. And I think ultrasound is a big area for all practitioners, new practitioners, not just experienced practitioners, but new ones in particular. But I'll go into more of that in a little bit with you and see what you think. So you had the idea of ultrasound and you found out about it over the last year or so. I personally, I'm a member of CMAC, which is a complications collaborative with practitioners all around the world. And they had a live with Leonie Schelke last year. And I was watching the live with her and I was asking her some questions. And I was just amazed at what could be done using ultrasound. And that's really what set me off. I thought this could have massive implications for safer practice if I were to use it myself. And that's where my interest really began. So once you looked into the whole area of ultrasound, what did you do? Did you undergo training and then choose a device? Or how did you go about what you were going to do once you decided that ultrasound was for you?
I am, I'm going to say, I'm a little bit obsessive when it comes to, I've got an idea. And I always knew that I wanted facial ultrasound. I always knew it. And I luckily got a contact, Ansa, who's, I think he's involved with the academic, regenerative medicine. I know that, the Academy of Regenerative Medicine, that's it. And I was booking onto the course, and that's how the ultrasound course. And he kindly enough offered me some just advice and guidance on the different ultrasound machines out there. And that's how I really come about with choosing Clarius. And, you know, Clarius is, the image quality is brilliant, it's portable, it's lightweight, you get unlimited cloud storage, lots of things like that. And they give you lots of support. So I think there is lots of pros against me purchasing this. And actually I purchased the device before going on the course, but it all kind of come at once. So I got the device, and then about a couple of weeks later I went on the course, and I was just so thankful that I went on the course, because again, a bit of ignorance is bliss. I know that a lot of people, and I'm not trying to name names, but I know a lot of people that have brought the ultrasound machine or any ultrasound machine and haven't got attended a course. And again, if you don't understand the ultrasound theory, then you won't understand that, you know, you might be putting too much pressure on the tissues. This affects your measurements. You know, it's much more technical than just like a point and shoot and on off you go. So, and then also having that support network around you, like you did only recently, I think with another practitioner, you know, discussing your images and having that kind of that feedback from each other. And if you don't go on a course, then you're very unlikely to then start to build them kind of networks.
But I've got to keep looking down here. I'm sorry, Cara. Just see what these messages are. We've got Dermifine Balsam, who's another pharmacist, a colleague of mine. She's asking, there are those who say invest in the device if your business is mostly dermal filler work. What are your thoughts regarding this?
Yeah, like I suppose it is that. Like most of my work is, you know, revolves around dermal filler, but I would say that, well, I would say most aesthetic clinics, one of their most popular treatments is dermal filler, but I can't speak for everyone. But the whole point of getting the ultrasound is making sure that, you know, you're aware of someone's anatomy, you know, particularly in the lips, particularly say if someone's an older patient and they have more mature lips, they've got less tissue, you're more likely to cause a blood vessel blockage. Then quick scan, work out where that blood vessel is. If it's behind the muscle, you're laughing, you know, you're absolutely fine, you're not going to cause a complication, but you might then change the way that you treat those lips with maybe a cannula if you wanted to. You know, there's pros and cons to, you know, cannula. You don't have to treat, or I'm not completely sold to saying that everything has to be cannula. You know, some things are better with a needle, but it just helps you practice safely.
How did you actually find the training with other practitioners around you? Were you learning from each other? Was it interesting speaking to everyone else that you were training with?
Yeah, like I think, like when I said to you when the 2-day course was really beneficial, that, you know, the first day you go away and you just think to yourself, am I ever going to be good at this? Is this ever going to happen? Like, because it's a really hard skill to get to hone, because your natural instinct when you're struggling to ultrasound an image is to push down more. It's just what we do. We're like, we just want to see it, so we want to push down more, and actually it's counterintuitive. You actually have to put more gel, ultrasound gel on, and press lighter. So it's a definite skill to hone, and it's again, it's information overload, and in a good way, but you have to kind of calm yourself down and think, okay, it's going to be a lot of information, I might not be able to process it straight away, I'm going to go away, review it, and then just keep building on it. So the second day, fantastic. And you got to obviously you're talking to other colleagues, that they're probably contemplating getting an ultrasound machine, or they already have. So again, you're building your network again, and just watching other people hone their skills and learning from them too. So it's really, really useful.
With you actually doing the training and learning these skills to use the ultrasound device more carefully and more effectively with your own patients, do you think that it has a bearing on perhaps training in future for practitioners, who undergo dermal filler training at different schools of aesthetics? Do you think there may well be some bearing of the use of ultrasound in training, basically?
Well, I think the crux of the matter is that if I lined up 100 people and I scanned 100 people, we would then think that your blood vessels, majority of the time, would lie within like certain percentages, but you're going to get anomalies everywhere. So for instance, MJ was talking about, who was on the course, who was teaching, was talking about in the nose, I think it's something silly like 1 in 160 or 1 in 200 people have a blood vessel that actually runs down the center of your nose. Now, when you're taught to do non-surgical rhinoplasty, which is basically nose filler, you're taught to, yes, you go deep, and you hope and pray, like without ultrasound, and you aspirate, and because the blood vessels are tiny, you have to aspirate a little bit longer, and they think that that's safe, but you just don't know. And if, for instance, you then place a large amount of filler on that blood vessel, it can cause spasm of the blood vessel, even if it's not within it, and then that can cause problems with circulation. So again, it's down to having a proper assessment of that patient. So it's definitely part of what I think dermal filler training courses should be integrating. Will a lot of practitioners take it up? I'm not sure, because there's the other adage of thinking, some people might think, well, we've been all right, everything's fine, like, I'm sure it'll be okay. And I suppose it's the people that are conscientious, like you and me, that are thinking about these things and thinking, no, like, you want to know for certain. You want to know for certain that you're being 100% safe. And if the person was sitting in front of you that had that blood vessel down the center of their nose, and then you said, actually, you got this, you should never have had this, or we don't think you should do this for you, I think they would be thankful. At the end of the day, you want to keep your face intact.
Yes. I think your patients will be happy with you saying that, I'm sure. And so will mine. So you carried out the training. Was that earlier? Was it in December, or was it early last year?
December.
December, so once you completed the training, you'd already had your Clarius device. I've got mine here, actually. So that's the Clarius L20 HD from Bell. Really great couple, Rachel and Ben, and they went through the initial setup of the equipment with me. So once you actually completed your training, how did you find actually using the ultrasound in your own work? How did you progress from not using it at all to using it a little bit?
So I've always thought, is that anything in life, you get better the more that you practice. And I practice mostly on myself. My husband, luckily, enjoys me ultrasounding his face. So he was always like, can you ultrasound my face? What's that? Like, and he's non-medical, so he finds it fascinating. And also, it's quite nice to talk to him about ultrasound, and checking his understanding of it, so they make sure that I'm explaining it correctly as well to him, or he understands what I'm saying to him. So I've definitely been doing a lot of practice there. But then saying this, I think I even started doing it certainly even before my course, just to kind of get a feel of it. I did have some training before attending the course. I know I scanned one person's lips before doing lip filler treatment, but then as soon as I come off that course, I just realised that you really just need to scan pretty much everyone that you're going to be doing dermal filler to, just so you kind of get that practice. But also just, it's helpful. It helps you to know that, if there is any kind of anomalies there or their anatomy, or just you just know you don't want to hit that blood vessel there, then it's perfectly there for you.
So really, you've been doing more mapping of the faces, patients' faces, before doing the work itself, I'm guessing. So, in terms of, like, for me, I'm quite cautious of the nose in particular, non-surgical rhinoplasty, and I think I will be certainly using the ultrasound a lot more in terms of mapping faces before I get to work with dermal fillers in particular. So, in terms of the progress, do you think it's time consuming using the device, or is there any disadvantages compared to the advantages, would you say, of the device, using the device in your work?
I suppose it is, you have to factor in, it's going to take a tiny bit more time. And I wouldn't say it's a lot of time. It probably takes you less than 5 minutes and I mean less than 5 minutes, to really scan someone's face. And if you're struggling, it's probably just because you haven't got enough gel on someone's face, which MJ definitely told me on the course. But, it does only take 5 minutes. So, but the other adage of that is to say to you that, yes, it might take you 5 minutes to scan someone's face, but actually then by the time that you then vascularly map them, so blood vessel map them, you're then confident. So then you can go, actually, your procedure might be actually slightly quicker, because then actually where you want to be avoiding. So in essence, you might save yourself some time. I know it saved me time doing people's lips, because I know that I can be like, okay, I know this is safe, and off I go.
Yeah, I think it's really down to improving practice, trying to get as much practice as possible, and gradually becoming accustomed to the things you weren't sure of when you first started scanning, I suppose. It's down to practice ultimately. There's one question from Balsam again. I suspect that this device will be part of the clinic checklist in the future, similar to an emergency kit. I suppose in future, I don't know whether things will change in terms of insurance, whether insurance at some point in the future might say those that use ultrasound, will their premiums be lower than those who don't use it? I don't know.
Like, say, maybe for drivers.
Yeah, well, it's similar, I suppose. If we're taking more care of what we're doing, and the risks with dermal fillers can be quite high in those that have a problem, I suppose you'd consider those that carry out the treatments more safely to be better in terms of insurance, the less risk. So I don't know, it's just something that might be considered in future. So in terms of using the device, you've been happy with it. Have you been happy with everything concerning the device and using it yourself, Kara?
Yeah, like it's just, in essence, it was like my new toy when it came, but I suppose it's just getting familiar with it, the clarity support that I got with the device, like setting it up, asking all the questions that I needed, knowing that they're there, even if I had, a question later on. It's been super, super simple. I suppose what I'd say is, don't be scared of ultrasound. You might be feeling a bit overwhelmed and thinking, do I want to add in something else into this? Is this going to be worthwhile? And I suppose, the crux of it is that it's safer. If it's safer, then, and it makes you sleep better, and it makes the patient sleep better, that I just don't have to say to them, if hopefully in 6 hours you'll be fine, you haven't got any kind of blood vessel blockage, you can sleep a bit easier. It shouldn't be like that. It should just be like a quick scan. Oh yeah, you're fine. Off you go. Everything's okay. So yeah, definitely get ultrasound.
Have you started? I suppose you're still quite new in terms of time to experience the device, considering you've only just recently used it and gone through training to use it as well. Would you say over this next year, would you increase your potential use of guided treatments, to use the ultrasound for guided treatment? And also, for me, I tend to see a lot of bot jobs, unfortunately, with lips in particular. I can blame people. I won't blame anyone in particular, but I can blame lots of different groups of people. But the issue is there is complications that occur as a result of fillers not being used properly. So I see problems with lips in particular. In terms of assessment, I intend using the ultrasound to assess patients who've been treated elsewhere with fillers, so I have a much better idea of what's happened and how the actual problem can be fixed. Do you tend to have issues like that? Do you intend to use the device for problems?
Yes. So I can think of one case that I had last year. This is before having ultrasound. And a lady had came to me complaining that when she smiled, that she could see a lump underneath her lip. She'd been treated elsewhere about a good over a year previously, and it always pretty much been there, but she couldn't quite remember when it really started. So I said to her, after assessing, obviously I didn't have an ultrasound machine at the time, and I said at the time, I think this is old dermal filler. I think you should have this dissolved. Well, she tried to go back in and get it dissolved from her clinic, and she came back to see me, and it was still there. But me being adamant, I was like, I really do think this is. I dissolved it, and at the time it wasn't quite going down, and I got it back later, and it actually did go. But at the time, if I'd had an ultrasound machine, there wouldn't have been any of this kind of faffing around, thinking, is it this, is it not? We'd know for certain that this is what the cause of the problem was. And she was so happy that, over all this whole year that she'd been saying that she got a funny smile, you know, and it's down to, again, like you said, botched jobs, down to injecting too close to the wet dry border and then causing these lip lumps. That I imagine you see quite often.
I've seen too many of them, unfortunately, and I continue seeing them. The worst time for me was after lockdown, after last 2020, around about July, August time, when all the patients started coming back for treatments. A lot of them had treatments from wherever they could get the treatment during lockdown, which was the worst thing they could do.
Of course.
Nobody could fix the problem at the time, and those that did the work didn't know how to fix it and didn't really care because they weren't trained to do it in the first place. So the botch jobs just came again and again from the summer of 2020, and it was the worst time ever. If I'd have had the ultrasound at that time, this would have saved me a whole load of messing about, because I would have been able to find particular problems far more easily than just guessing, and that's one of the benefits for me. I think the ultrasound will help me, give me
isn't it? You can look, you can scan someone's lips, you can say, where is that old filler, or where is this, but dissolve under direct guidance, use less amount as well, don't have to flood the whole area. It's just the pros go on about ultrasound. Why be blind when you can see? It just doesn't make sense.
It's like informed consent with the patients. You make sure you gain consent, but the information you provide must be specific for what they require, and that's what informed consent is. And for me, I consider ultrasound to be a form of information. I get informed before I do the treatment. I get informed during the treatment, and if I want to, I can be informed afterwards as well. So for me, this is like improved information. It just gives me what I need to do my job a lot more safely and more effectively as well. In terms of using the device, perhaps there's a lot of practitioners that are thinking about it. They're a bit curious about ultrasound, but they're not really sure. And perhaps they're in a position that you were in maybe a year ago, just getting to grips with the idea of ultrasound. What advice would you give those practitioners based on your own experience, Kara?
I suppose not everyone has to be so gung-ho as I was. I was just certain. I knew that I wanted an ultrasound machine. But I suppose what would be a more, I won't say sensible, that's probably the wrong word, but a different approach than my gung-ho attitude would be to go on an ultrasound course. And I know that they might be an expensive outlay because, you know, if investing in something, going on a course that you might not necessarily then progress to do might be, seem a bit odd. But the course that I went on had all different ultrasound machines, so you could try different models and then see how it works in person. And the nice thing about the course, it wasn't just scanning you know, the face and that's all you did. You know, you did do treatment under ultrasound guidance. You got a really good feel of it. Obviously it taught you all the theory, so I definitely think a course would be quite good for people, just so that you could get a feel of whether you want to try. But I think it comes down to the practitioner. I think if they've got that idea inside their head, it will grow. It's a bit like a seed. It will just keep on going and go, and eating, it's in essence eating away at you until you kind of go, oh, fine, why not do it? Okay, so, yes.
Do you know any other practitioners that use ultrasound yourself? Do you know anyone else?
Not in, well, actually, no, that's not true. I think there's one clinic in my, like, in Norfolk area. I don't necessarily say that I've been in contact with it, but I think I know of one clinic. But I've started to build a little bit more network. Their course was incredibly helpful, so that you could find similar practitioners to join with. And obviously it's been helpful to be introduced to yourself. But also because I'm an ultimate geek, I just love watching other people's ultrasound images. So I've been loving it. So, you know, social media is in essence social. You know, it's there to learn. I have learned so much of just being on social media. Don't get me wrong, there are things that you have to take with a pinch of salt, and you have to have reputable sources. But, you know, building that network of other ultrasound users, you get to see their images, and then you just think to yourself, well, that's really interesting. And it kind of keeps igniting that passion with you, having just think, I've got to get better at this.
Yes. It's improvement, gradual improvement, and continual professional development. Basically, it's trying to improve what you do every day. For me, I, as I say, Leonie Shelker in particular, I follow her on Instagram, and I love looking at the work she does. And I recently, over the last few months, I tried using computers generated imaging to actually augment ultrasound video. So I don't know if you've had a chance to see, but I've got a few videos that I've augmented of Leonie's, so you can actually see the actual video more clearly. It's overlaid parts of the tissue with colour, so it actually moves without you having to guess where the tissue actually is. And Leonie, she said to me last week, she said, Viv, you know what? That last video you actually motion tracked, is better than my own video. So I think she enjoyed it.
That's good. I love stuff like that. So keep that coming.
Yeah, I'll carry on with it. I've got to thank actually Carolina Mary Lewis, I think she's called, a doctor and a radiologist in Argentina, and she was the radiologist that was helping me with some of the work I was doing just after receiving my Clarius. And she's really nice. Hopefully I'll get to speak to her as well in a live with a few of the other specialists in ultrasound. I also wanted to thank Rachel and Ben at Bell, who are fantastic. They provide fantastic support to do with the device, and any problems, they tend to be around all the time to give you quick, effective, efficient support as and when you need it. So I just wanted to say hi to them and thank them for it. Was there anyone you wanted to mention in terms of your training, or anyone that you've come accustomed with following your training, or support that you've got?
There's just so many. Like, do you know what, Viv? I've really found social. I know I keep talking about social media, but you know, social media really brings people together, and I've really found that there are so many lovely practitioners out there, as well as like customers. They're all lovely as well. I kind of see, but I'm talking about practitioner support. But also the companies that, you know, that help you, particularly with the Clarius. You know, it's a new thing. They know that you're all new, and it's all a bit you know, scary, because you think there's a new skill, and they're doing okay at this, and having that support. So, you know, everyone that's helped me get to where I am with ultrasound, and just giving that kind of helping hand if you ever do need to you know, have that support. I know with you said the CMAC that I know that they have the Clarius device, I think. I'm not quite sure with because I'm a member of the Aesthetic Complication Expert Group, so ACE. I need to contact them to see whether they use Clarius, because you can obviously link up with them if you do have any complications. So, you know, that's the adage of saying, you know, ultrasound is the future. It may be slow for people to uptake, but it kind of it's going in that direction. It's gaining momentum. It's a bit like going like a snowball going down the hill. It's going to get so.
In terms of the future, what are you looking forward to with your work and perhaps with your ultrasound? What have you got planned to do in the future, Kara?
So definitely, I do really love. You know, I used to teach a lot, and you know, I'm already busy enough as it is now, and I've had to stop doing advanced life support teaching, but I've loved doing teaching, and I feel like with ultrasound, I just loved creating, a bit like yourself. I love creating educational content. You know, there's a good mix of actually having a laugh and getting people's attention and you know, keeping people at your forefront of your mind. But there, you know, there is also that social responsibility of, you know, doing your job and doing it well. You know, your videos that you said that with your overlaying colours, they sound fantastic. And it's just, you know, continuing to use ultrasound, continuing to build your network, and continuing to educate both practitioners and customers, or patients, whatever you want to call them, about the uses of this and how to keep them safe. So that's where I kind of continue to keep going. And plus, I just really love what I do. So just keep going.
It's nice to be able to talk about things like this, because I suppose your clients, your patients don't get to see behind you in the clinic. They don't know what goes on in the background in terms of the other work you do and about your interest in the ultrasound, for example. I think it's nice for them to be able to see things like this. So I've got to thank you for that. What I always do at the end of my life, I think we've got about 5 minutes. I tend to go through a few quick fire questions with my guests, and I hope that's okay. I've just got a few questions to ask you, nothing to do with ultrasound in particular. It's just general questions, and you can answer them in however you want. It's totally up to you, but they're just quick fire questions just to get a reaction from you more than anything. Is that all right?
I'm brutally honest, Viv, so here we go.
Okay, right. First question. What's the strangest Christmas present you've ever received?
Oh, God. There's lots of, like, whether, you know, what kind of answer do you want to give to this? I suppose I can once think to, but what did I get given? I suppose what it was, I can't remember what it was. It's not like something like socks or anything like that. But yeah, I can't. Do you know what? I can't actually remember. I think it was something like really awful, like from like an ex-boyfriend, something like kind of nose hair trimmers, which is quite offensive. But you know, anyway.
That's strange enough. That's strange enough. Don't worry, that's good enough. I'll go to another question. If you could work on anybody's face, who would you choose? You've got anyone in the world and you can work on their face, no matter what. Who would you choose? You can only pick one person, though.
Oh my God, so there's so many. So you might have seen that I absolutely love talking about celebrity faces. Absolutely love it. And I will be quick. But there's so many to do. So I suppose what I'd say is that I did one on, there's a lady called Megan Fox. Now she's quite a young girl, but she has got the most beautiful features. And then, you know, you've got people like the Duchess of Cambridge, like Kate Middleton, which is obviously not now. She's absolutely fantastic. It's more just kind of understanding and definitely knowing what they've had done. So I suppose it's being nosy. I just want to know.
That's fine. That's fine. You could go on forever about just that one question, couldn't you?
Oh, God, there's so many.
We'll stick with Megan. We'll stick with Megan Fox for now. Anyway, we'll stick with her. Do you prefer cats or dogs?
Oh, right. So this is a loaded question. So I grew up with lots of cats. My mum is a massive cat lover. She loves them. And so do I. I was the instigator for getting cats. But now I have a dog, and my husband is allergic 2 cats, so that's
Oh,
not going to happen, I know.
oh dear.
But to be fair, I am a sit on the fence kind of person. I love all animals. I'm a bit obsessive with them, and yeah, and I absolutely adore my dog. So I suppose I'm gonna have to be biased. I say dogs for the time being.
Dogs. Okay, fine. If I ask you that question in the future, you might change your mind, perhaps,
Might become
depending
a
on the
crazy cat
situation.
lady, so we'll see.
Next question. When was the last time you thought to yourself in your head, you're talking complete rubbish? When's the last? I could have said that in a few different ways, but I kept it mild. I didn't put any swearing in that. But when was the last time you thought, you're talking rubbish?
Oh,
It wasn't during this live, was it, with
no,
me?
definitely not me. I suppose what it is, me and my husband have a very, very good relationship, obviously, and we often call each other out, but we're always normally just being silly. So I suppose it probably happens on a daily basis, but we're always trying to kind of catch each other out. So it's likely my husband. So.
Fair enough. Fair enough. I think he'll be happy enough with what you've said. You've got a choice. Wine, gin, Guinness, or water?
Definitely wine.
Wine, right? Okay.
Like if you've got to pick, like this is the rest of your life. No, it's going to be pretty rough if it's going to be for the rest of your life. So maybe I'll change to water. But still, you know, it's one of my favourite drinks is just having a nice glass of wine. End of the evening, if you're going to, you know, I don't drink all the time, but you know, that occasional just kick back and relax.
Fair enough. Have you ever gone to work without makeup?
Yeah, all the time.
Yeah.
Like,
do you? Right.
Yeah, all the time. So I don't I often don't wear a lot of makeup because when you're wearing masks, it's not great for your skin, it doesn't make you breathe, you have breakouts, all this kind of stuff. But also when you've got good skincare, then your skin's okay. You know, lady said to me today, I was just having a conversation with her, and she went, "Have you got no makeup on?" I was like, "No, I don't have any makeup on. I've got makeup on now, but." I said, you know, at the time I didn't, and I said, you know, it's just you don't need makeup if you've got good skin. So
Yeah.
you know, I can give or take it. So yeah.
Great. One more question. Have you ever eaten haggis?
No, and I want
No.
to. I feel like I've not lived.
Oh, you're going to have to. You should go to Edinburgh, and there's lots of trips around Edinburgh, and you can visit different places to eat. And haggis, you're going to have to try haggis if you've never eaten it before.
No, I think. What is it? What can you describe what it's kind of like? Is it like black pudding, or am I completely off?
Not. I hate black pudding, to be honest with you.
I love it. I'm terrible.
I can't really describe. You're going to have to just eat it. You're just going to have to try it for yourself.
Gonna have to go to Scotland. I really do need to go to Scotland. It's on my bucket list, definitely.
Yeah, you'll have to plan that. One more question. What would be your ideal job?
Oh, do you know what? I'm going to be a bit cheesy and say this. Like, I really do love doing aesthetic. I often do feel like it's not really a job.
Yeah.
Like I really do love doing it. I love talking to people. I love helping people. I love doing aesthetics job. So I feel I'm really quite lucky.
Yeah.
I would be bored if, you know, for instance, if I won the lottery tomorrow, still would do aesthetics. I really love doing aesthetics. So.
I know what you mean. If it's a hobby, and that is the best job of all, something you love doing is a hobby, I think. The very last question, Kara. Have you enjoyed doing this Instagram live with me?
Yeah, it's been brilliant. It's been so much fun. Like I said before, I love talking to people, and we seem very, very like-minded, and it's just been thoroughly enjoyable. It's nice to speak to someone really like-minded and talk about ultrasound and really try and promote safer practice. So yeah, it's been great.
I've got to thank you. We've been talking for over an hour now. I'm surprised we haven't been kicked off, because it's gone over an hour. So thanks, Instagram, for not booting us off too quickly. I just like to say thanks a lot for agreeing to take part and talking about your work. So I've got to really thank you for that. Perhaps in the future we could do it again. We can see how we both progress with our aesthetics work and our ultrasound use. Maybe we could share live scans with each other and see how we go. It'd be nice to do that. But But I think I've got more Instagram lives planned over the next few months with different people. And hopefully I'll do a four-way live with a few different practitioners. And at some point in the future, perhaps you'll come back and we can talk again, either the two of us or within a group of a few different practitioners together.
Yeah, it'd be really enjoyable. The more the merrier.
Great. Okay, then. Right. That's been a really nice hour we've spent, and I've enjoyed talking to you. Really, it's been great. So I will end this. The live feed should go up on Instagram, and it should appear on your feed as well. I think I'll add you, I'll tag you, and hopefully your patients and followers will enjoy watching it.
Yeah. Oh, thank you, Viv. It's been a pleasure.
Great. Thanks a lot, Kara, and I will see you hopefully again some point soon.
Yes, definitely. Bye for now.
See ya. Bye.